Welcome back. This is still the Press on KAFTAN Television, and we are reaching you live from the nation's capital, Abuja. Right now, I've been joined by a very special person in the studio to discuss some of the headlines that made it to our national deadlines this morning. And joining me is Lois, who is a sexual, gender-based, and mental health advocate. It's glad to have you this morning.
Thank you.
How are you navigating the weather?
Yeah. It's cold this morning.
It is.
I'm enjoying myself.
Right?
I'm liking the cold.
Oh.
Yesterday in the afternoon it was really hot. Yeah, and I was in the sun all through because we had the celebration, in commemoration of the Day of the African Child. And we had a massive turnout of kids with so much culture, their cultural dances, and they just applauded Nigeria and pledged to be patriotic, students, at their age. It was amazing.
It was amazing. And I would like to know, maybe I missed it already, but how are they coping with our girls being enlightened more? Are they how is the teaching going on with them?
Basically the theme for the Day of the African Child is education for all the African children. The time is now. So basically it's just to remember the children at the Soweto uprising. Hundreds of children were killed, thousands were shot down, and why? They just protested because they wanted to be taught in their own language and they wanted to be taught properly. That was what they were advocating for, and they were gunned down in Soweto in South Africa. And the Day of the African Child, even if I don't celebrate any day, I always celebrate the Day of the African Child because it's very, very important to me. It's every 16th of June, and we always do something to remember that day, remember how it is important that children should be taught properly, and not just getting teachers but trained teachers to help these children. If not, the people that died, they would have they'll just die in vain, and that's not what we want. We want children who are well educated, who after they have they come out with their certificates, we know that they've done the right thing. I don't know if you've seen the trending issue of the lady that said she came out of school, with she came out of school and she slept her way through school, and all of that, and the university is now asking for a certificate. That's not what we want. We want people who have gone through school have gone through them, not just the teaching and education aspect, but the moral aspect, every other aspect, and
that is interesting. Okay, let me quickly get your reaction of this before we look at some of the headlines that made it to our national deadlines. The presidency responded to a New York Times report. I don't know if you know about the report. The report, reports criticizing Nigeria as one of the worst tragedy in a generation. Now, to that effect, the special advisor to Mr. President, Bayo Ononuga, has responded to that report, saying that President Tinubu did not create the economy problem we are facing today as a Nigerian, that he met a bad government. He was just basically saying that nobody should blame Mr. President for the bad economy we have today, describing the economy as already bleeding before Mr. President takes over seat. Let me get your reaction in this before we move on.
I would say that
is Nigeria really the worst in a tragic generation?
I don't know why you be asking me that kind of question.
Because I want to know.
We are actually going through a lot in Nigeria. I must say we are actually going through a lot. I went to see the children yesterday, like I said earlier, and we had a sit down and we talked about some of the issues. We see that a lot of children are going into child labor. I'm a sexual and gender-based advocate, and I see some of these cases, and honestly my heart bleeds when I hear some of these cases, and it all goes back to poverty.
Yes.
When you look at all of these things, it all goes back to poverty.
Yes.
And that's one of the issues that we are struggling with in Nigeria. I would say let's not point blames at everybody, because each and every one of us have our responsibilities as Nigerians, but there's some responsibility that are just peculiar to the government, and I feel that the government needs to start working on those things, especially when it comes to things like education, when it comes to things like inflation, and some of these economical issues that we're going through. Health, very important. We need to, but pointing blames at, Tinubu, this, that, in your own constituency, in your family, what are you doing as an individual to help the economy, to help? Okay, let's look at teachers. It's a small this thing, but teachers, you go to school, you do not teach. You say, because they have work. This is happening now WAEC just ended, and some children were seriously complaining that once there's WAEC, the teachers, the head of school will pack all the desks into the hall, and the remaining students do not have seats to sit down because they've registered people from outside, you know, so they don't have seats to sit down. And when they don't have seats to sit down, they start hanging around, they start dancing behind the halls and doing all of those things. And at the end of the day, we say we are pointing at the government or one thing or the other. In your own space, what are you doing as a principal of that school? I don't want to mention the name of the school, but as a principal of that school, what are you doing? And I know this is happening in a lot of schools. You know, you get to see WAEC and NECO, during WAEC and NECO exams, a lot of them students, a lot of schools are not teaching, you know, because of that issue. So as individuals, as teachers, as a woman in your house, as a mother, what are you doing, you know, to enable the economy, to help yourself and all of that? You know, I just feel that we should not point blames at people. We should also look at ourselves. And I feel that the United States do not need to really do that to us. We know we can insult ourselves. It's okay for us to insult ourselves. I don't think they need to join at their mouth, you know.
Exactly.
Yeah.
It
felt insulting.
It really is.
Yes.
A whole Nigeria giant of Africa. That's a slap on our face.
Yeah.
But on the second thought, I feel like this should challenge the government to do better, because but
is it the truth?
It's
the truth.
I don't know.
I feel like it's the truth. If you ask me, I feel that we have a lot of economical issues.
Yes, we do.
Yeah.
Likewise, every other country, there is no country that is left behind when it comes to economical issues and the rest of it. But they just find a way to curtail it or to manage it in the sense that it doesn't go beyond control. I feel that's what the government should do, and this should, you know, make them to whatever.
Since our news is already getting to the national table,
I felt
and the UN should also come in and help us. If they can note that there's a problem somewhere, they can also come in to help us, because we always need help.
You know, that's why we are UN, United Nations. So
so they should also come in. You know, sometimes they used to say an adage that once you have seen a problem, as you have seen it, that means you're the one to also help to solve the problem. So if we have a problem like that and the UN have noted that there's a problem like that, then they should come in and help us solve the problem.
Because of course, when the eye cries, the nose cries too.
Exactly,
so
affects each and every one of us. Yeah.
Well, that's by the way. Now let's see some headlines. I was going through the national dealings this morning, and they almost all the papers had this cholera outbreak, and it's beginning to escalate, especially in Lagos and some other states that were mentioned, Ogun and the rest of it. So I don't know. I know you are gender-based advocate and the rest of it. Can you enlighten us more on how to? I know the government is trying to do something to curtail the outbreak and the disease, but on our own part, what do you think we should do as an individual to, you know, stay safe or not be a victim of this?
This cholera outbreak is a real issue, and I feel that it's starting small, but it's something that we call cholera. So I happen to do a course on epidemiology. So you know, in that course we were taught how some of these things spread, pandemic, epidemic, and you know how some of these things that we see as little spread. And there's this guy, I think his name is John Snow, I can't remember his name. You know, he's one of the icons when it comes to health and some of these things. So there was a community he went to, and in that community they were suffering from cholera, and what he went to do was to change the head of the tap.
Oh wow.
Once he changed, because everybody in that community was using that particular tap.
Yeah, I think so. I saw somewhere that government has said that water should sample water should be tested or something.
Yes. They've engaged some people. Yeah, I saw it in the newspaper as well. They've engaged some people to go and test the water and all of that. But when the guy, the Jon Snow, went to just change the head of the tap. Once he changed the head of the tap, because everybody is having contact with that particular bacteria. You know, I think the name of the bacteria is Vibrino. So once you get in touch with that bacteria, you either insert it to your mouth or nose, or it gets in touch with water or food or some of these things. And you know us in Nigeria, watermelon is already peeled open, and immediately we get the watermelon, we open it and we eat. These knives are rinsed in some of these waters that may not be so clean. Coconut is peeled open, and you know, some of these issues, you know, we have them in Nigeria. So I feel that, you know, if we as individuals take it upon ourselves to properly clean, properly wash, properly boil, you know, it will help cope some of these effects. And I would also talk about hygiene, because that's like the major thing, especially people that are selling food vendors, because
especially these ones at the roadside.
At the roadside, you know, with sewages that are very unkept and a lot of things. So it's very important that we look into that, you know, those that are now that we have seen lots of death. I saw we have 21 deaths, and we have 401
cases so far
in 2024. We're still fighting cholera. I feel that it's a big issue, and I feel that the World Health Organization should sweep into actions, and there should be lots of awareness about some of these things, because when you hear cholera, people don't even know what it is. They just feel that it's a stooling, continuous stooling, but cholera is more than that. Cholera is continuous stooling as well as vomiting. So you are releasing lots of fluid out of your body, and if it's not well contained and quickly contained, it can lead to death. So it's a bacterial disease, but it's also as quick as a viral disease, you know. So it's very important that we should, you know, quickly look into this issue. And I see that it has been spreading. I see that the Imo State governor has also, you know, said started, you know, sensitizations and started some of these things in his state. And I feel that all the governors should also do the same thing. Let's not wait for it to come to us. It's already in Lagos. Let's not wait for it to come to us. Yeah, let's start working on it. Let's start doing something about it. Let's start advocating. You know, if you are using this, please wash your hands. Don't use this. Use your gloves. Use that. And you know, even entering public transport. Let's go back to our sanitizer days. You know, where we had sanitizers in our bags and we have to clean our hands properly and all of that. Because somebody may just be flying in from Lagos to Abuja today, and the person is in contact with you, and from there you shook the person, and the person is just coming from the toilet after washing but not properly washing his hands. You know, these days a lot of people just quickly rush. A lot of people are in a hurry. The hustle is real, you know, and all of that. So you're telling me to now start looking into cholera now that the hustle is real, you know. So it's very important that even as the hustle is real, we should remember our health. Remember, we used to say health is wealth. Yes, so let's remember to wash our hands properly, you know. And before we eat, in those days, say before we eat. Nowadays, you just see, I was somewhere and I saw somebody trying to give somebody food. The person was just coming, he just cleaned his hand on his throat and he picked it and he ate. Now there's cholera outbreak. It's important. We're not causing a scare, you know, but it's important that we try to be clean. It's important that we try to be safe. Wash our hands properly, and not just for us. Children have low immunity, so it's very important.
So I was going to that extent because 2 years ago, I visited a hospital I was on treatment, so I went to take my daily injection. So in the hospital, I overheard the nurses saying that just in that week they've lost about 4 to 5 children in that particular hospital, and that time was during the January period. You know, after the festive period was December. Everybody just keep on eating everything and all that. Okay, coming down to the kids, we know we can actually not. There is no way you try to manage the kids, but you can't manage. You won't be able to manage them 100%. And some persons have advocated that the schools should be shut down at least for the moment, because Nigeria is going through a lot. Look at the economic, look at the inflation, look at the economic crisis and all that. People don't even have money to feed, let alone going to the hospital. So are you in support that maybe the federal government should shut down schools at the moment while they try to curtail the cholera outbreak? So
the thing is, it's a train. If you shut down schools, it's going to affect parents. Where are they going to keep their children? So parents have routine. They go, everybody leaves the house. I know a particular family that everybody leaves the house in the morning. From the house, they drop these children in school, they go to work. They engage their children in extracurricular activities like maybe lesson or football or something, so that they can also finish from work and meet up with the children, pick them on the field and then bring them back home. So it's like a routine. So you can imagine just leaving your children that are really young at home and then all of that. So I feel that shutting down schools is not the right, you know, way to go about it, you know. So if we can educate our teachers about it, what can we do? Let's wash our hands properly. Let's do this. Let's sensitize schools on what to do. I went to a school the other day and they had like a bucket outside. Before they eat, all these children in KG, preschool and all of that, they line up outside. They wash, the teachers help them wash their hands. The nannies, you know, help them wash their hands. And after washing their hands, you know, they go back into the class. After eating, they do the same routine again. So, and they do it properly. So I feel that if we can do that, you know, schools can do that, it will help a lot of things. Because what you say as a parent, you say, oh, I'm taking my child to school, I'm unable to take my child to school because schools are closed down because of the cholera outbreak and all of that. Apart from that, the scheme of work, everything they need to do, the third term is almost coming to an end, and this is a very important term. The third term, the promotion exam and all of those things. So I don't think that schools should be closed down. I just think that we should really watch out for this thing, and we should not take it as a government thing. We should not take it as we should take it personal. Okay, so what do I do? What are the things I should set aside in my home, in my family? What can I do to prevent cholera, to prevent it from affecting my home? So it's our responsibility, really. I feel that the government has things to do, testing of water, doing all of that. In Maraba there, the World Health Organization did something by purifying waters in Maraba, and the guy comes, purify the water for free. Does that. In fact, they did that to one of my mom's houses in Maraba, and she's really excited.
Wow.
So I feel that if we can have more of that, if you taste the water, it is different, it is clean, and the World Health Organization would call her and ask her, oh, did the guy that comes to test the water or clean the water, did he come this month? They help her to change the filter in her drum and all of that. So she's really excited about the water, situation in the house and all of that. So I feel that if they can do that, and that's in Nasarawa State, so if they can do that, in other states or schools and all of that, it will make lots of sense.
Okay, no, that's a great one. We've run out of time, but before we sign out, just give us what in your own knowledge, or to the best of your knowledge, what do you think the federal government should do on their part, and as individuals, what do you think we should do on our part to stay or be able to maneuver the outbreak?
Okay, I'll say to the federal government that this looks like cholera. I know it's a common thing, it happens, but I feel that they should swim into action quickly so that it doesn't spread. We have seen people are already dying from it. 21 is a huge number. It's 21, but it's a huge number. So I feel that they should swim into action. They should go into water testing, sensitizations, just like what KAFTAN TV is doing this morning. And all of it's very, very important that we do all of that. Then as individuals, let's try to make ourselves clean. Our families, our community is our responsibility. As a chief, you're watching us this morning. As a woman leader, you're watching us this morning. You have each and every one of us. We have our community. You're the executive director or founder of an organization. Your employers, it's important that just organize a sensitization program on cholera. Let them know what it is, because a lot of people don't even know what it is. When you hear cholera, a lot of people, their mind goes to stooling, but it goes with a lot of excess of vomiting and releasing of fluids. So it's very, very important that each and every one of us are sensitized about what it is. As an individual, go on Google. Google is your friend. Check what is happening, and all of that, and let's be safe here.
All right, thank you so much for
welcome.
giving your contribution this morning. We really do appreciate, and from all of us here and from KAFTAN Television, we care about you wherever you're watching us from. We care about Nigeria as a country. We care about our government too. So that is why we brought you this cholera topic this morning, to help you stay safe out there. Like my guest has said it all, maintain a proper hygiene. To me, that is just the best way to be able to not to be a victim of this cholera outbreak. Maintain a proper hygiene. Be mindful of the things you eat and drink, especially with your kids, you in the family. Make sure you maintain a proper hygiene. That's just all I'm going to say to you this morning. And to this point, this is where I'll draw the curtain on the press, and until I come your way next time, keep watching KAFTAN Television. I am Messi Emelite. Enjoy your day.